Hello, today we're going to talk about teaching diabetic education, and we're going to use some of the examples of AccuCheck and urine testing so that if you're going to be working with patients, you need to know your equipment, you need to gather all your equipment before you start and go step by step with them. I'm going to go over several different types of glucometers and flex type pens that are used for insulin administration, because you may be teaching patients or their families about not only injecting with these flex pens and glucose monitoring is really important for them to be accurate so that they do it accurately so that they will know how to manage their diabetes effectively. So first I'd like to talk about the AccuChecks or the glucose monitors. There are a gazillion type of monitors out there. I've got a few examples here to show you today, and they're probably some of the most common, but they are always coming out with new monitors, new equipment. It's always important to be sure to read the directions to know exactly how to use the monitor. Strips are different. They even have right now an electronic version called the Precision, and you actually scan your lancets, you scan your strips, you scan the patient's ID band and do that. And those are used typically in the hospitals. Usually if the hospitals use those type of monitors, they will instruct you on how to use them before we actually use them. Your instructor may actually instruct you with those. So let me start with the first type. This is the AccuCheck Advantage. This is an older model. Most of these usually show the numbers very large because a lot of people have eye damage. Sometimes it's hard for them to see the numbers. I'm not actually going to use this monitor, but most of monitors, you turn them on. They will have an on-off button, and then it will, especially the AccuCheck comes on. It may, usually they tell you kind of walk you through all the steps and tell you what to do. You will need strips that correlate with your monitor, and one of the things that when the monitor comes up, it will have a code on the monitor, and the code is actually related to this little strip that, or this little key that fits into the back of the monitor at some point, and it clicks in, and it is correlated with the code on the strips. So that's one thing that you have to check, that when you get a new bottle of strips, and you need to teach your patients too when they get a new one, that sometimes these little key codes are in the bottle, and so that they need to change the strips when they get a new strip, so or when they get a new bottle of strips. So you match up on the bottle the number, and it should match up with the code on your screen. Now, one other thing that sometimes you will need to do, especially in the hospitals, from time to time they will say run controls. It won't let you take another blood sugar until you do what's called running controls. And with that, you check the code, you put a strip in. Usually the monitor will have a little picture of a strip, and it will want you to put the strip in. Once the strip's in, then it'll ask you for a drop of blood. When you run the controls, you put the strip in, get the strip out, you put it into the machine. Usually the metal edges on the strip are the part that actually go into the machine, and then you're pretty much ready to get your blood sugars. But in the case of controls, it will ask you to run a control. So you'll take one of these little control bottles. This is a level 2 on this one. This is a level 1. They usually correlate with a normal or a high blood sugar level. And so what you'll do is take, according to the directions, and put a drop or two right in the reagent strip, and then wait for it to process. These AccuChecks usually kind of do this circular thing when they're running and processing, and then once this is in there for a certain period of time, it slows down, and then it will read the blood sugar level. After that, you'll you usually have gloves on. You'll take your strip and dispose of it properly wherever your facility has you dispose of them. So I wanted to show you just a couple of some of the newer strip. This is an older strip, and when you fill this strip, either with the control reagents or with your blood, you need to make sure you have a full dripping drop of blood for it to have enough blood to process. They make some newer strips now that are a whole lot nicer, and they actually fill from the side, and they take less blood, which is really nice for a lot of our patients that don't bleed very well. Show you one of them. Oh, by the way, these reagent bottles usually have a little packing packet in them, and they need to stay in there, and you need to not leave the lids off the containers very long, because it keeps your strips fresh and they're more accurate. So teach your patients also to do the same. If you see this strip, you can see that where you actually put the drop of blood is to the side, and it just kind of sucks it right up, and once the numbers start processing, you know you have enough blood. This is kind of a more familiar and kind of the newer AccuCheck strips that are used. This is an Ascension monitor, and all these monitors have memories in them, and especially the ones at the hospitals. You will punch in a hospital number on your patient. Sometimes you will have a number that you will also punch in that will also record who took the blood pressure, who took the blood sugar, and then also the patient's blood sugar levels, so that those can be retrieved electronically. Again, every monitor is a little bit different. The monitors are usually free. The thing that gets most patients is paying for the strips. They can be very expensive. So again, the Ascension has a little different kind of strip. As you can see, it's this is the part that goes into the machine, and then it goes in like so, and then the drop of blood is administered at the very tip there. Okay. The next kind of monitor I would like to show you is the AccuCheck Compact Plus. This is even a newer, one of the newest AccuCheck methods. This is actually the Lancet, and we'll talk about Lancets here in a little bit, but it's right here, fits right onto the machine. With this machine, instead of having individual strips, they have a little cartridge that contains looks like 16 strips in here, and so you just insert it here into the machine, and when you turn the machine on, actually the strip automatically reappears, automatically appears, and it'll come out here. I'll show you that here in a minute. So they make the machines very, very user-friendly, but like with anything new, it's really important that you read the directions on how to operate the machine. Now, the next thing I'd like to address is the Lancets. Lancets are tiny little sharps that we prick the fingers with. Whoops. And they make, and you don't always have to use a device that holds the Lancet, but especially if you have children or people that don't like to see the sharp, some of these work really well. These two have the needle hidden, and there are many other devices as well that will do that. This is an older version, and the Lancet is protected by a little covering, and they come in all shapes to fit all different kinds of machines. With this type machine, you insert the Lancet like so, and usually the tip doesn't fall off. And then you caulk it back into place like this. Sometimes they used to have a little appendage that sticks out here with a hole in it, and you would hold that up to the patient's skin, and then once you've prepared the skin and the site, you hold that up right close to there, click this like it, take the little end off, click it, and then it will prick. And depending on how deep you put this into the holder here depends on how hefty a stick you get. So now, in my practice, I like to stick a patient good because if you get really wimpy with your sticks, you have to stick them 2 or 3 times. Sometimes, they're used to be getting stuck all the time, and it really gets to be aggravating for their fingers and that kind of thing. This is another type device for actually doing the stick. With this takes a flat lancet that we don't have any. Again, you just unscrew the tip like so, stick your lancet in, screw this back on, take the cover off, put the device cover back on and screw it in place. And you notice there are numbers here at the bottom. So if you need it to go deeper, then you just dial this in. If you need somebody that's got thin skin and they're not a hard stick, you can put this back at a lower number. Then once you have your skin prepped, you hold this right up against the skin and then press in, and usually this thing has to be caulked for you to do that, and I don't have a lancet that fits it. But anyway, once you get it in place, it will then engage and stick, and then you're done. When you're done, then you just unscrew, remove the lancet, and replace the cover. This is another one. This, you remove the end like so. You put your lancet in snugly. You remove the cover. Carefully replace this into the device. And again, you can set the depth by dialing this in. You put this up against the skin, press the blue button, and then it engages. Okay. All right. A lot of patients just use the lancets. Now, I want to talk about the site preparation and proper technique for preparing the site. Now, if you're teaching patients at home, a lot of times if they've got running water at home, we just ask them to wash their hands good with soap and water and dry them on a clean towel. They don't always necessarily have to have alcohol, but if they have alcohol, then what we like to do is, especially in the hospital setting, or even if patients are doing this at home, their hands need to be warm. You might need to warm them with towels beforehand, especially a lot of these people have cold hands. And so if you warm them good before trying to get a blood sugar, you usually have a lot more success. So typically when we look at the sites to use, we try not to use the very tips of the fingers because there's a lot of nerve sensation, and also they sometimes tend to be more calloused, especially in people that work outside. And so, but usually anywhere along the side of the tips of any of the fingers usually do well. I kind of look to see if they've been stuck a lot or if they prefer a certain finger. Again, usually these 2 fingers on each hand typically have less calluses than the other fingers or thumb. you've explained to your patient, or you're teaching your patient about what to do. If the hands were grossly contaminated, I would suggest that they wash them first. In the hospital, we always use alcohol to clean the site with. You want to go ahead and clean the site well with alcohol. You want to let it dry, and with this type of monitor, I would turn the monitor on. You can see it comes on, and the little strip comes out right there at the end. It beeps, and it's giving me the signal that it's ready for a drop. Now I'm going to take my lancet, and I'm going to do a nice good prick right on the side of the finger, like so, stick, and can squeeze a little bit. I just want a little bit out. Then I want to wipe it off with either a cotton ball, or you can use a 2x2, or a non-lotion tissue. And then I'm going to get enough of a drop of blood that it goes right up into the end of it's being sucked up in there, and it beeps, which means I've got enough. I give the patient the cotton ball, let them go ahead and hold some pressure to their finger while this is reading. And so you see it didn't take very long, and my blood sugar is 92. So I would compare that to the normal range depending on what time of day and the last time the person had something to eat. So this falls into the normal range of blood sugar. It's been more than 2 hours since I ate the last meal, and so this would be normal. Now, if it would be within 2 hours after eating something, then it might be higher than that. And so you would need to compare appropriately. You need to teach your patients about how to do that. And then basically, you just, this now, you touch it again, and it ejects the strip, and then you can dispose of your strip appropriately. And it turns off then. So pretty handy, huh? So, now, one of the other things that we teach patients with diabetes to do is to do urine testing. Now, we don't typically test urine for blood because it's really not an accurate measure of their blood sugar at the time we test it, because urine can sit in the bladder for sometimes hours, and that's why it's not really good for that. But what we do have them test for is for ketones in their urine, because in times of illness or other times, it's important for them to know if they're throwing ketones or not. So what we do is have them get a urine sample, and then what they do is we just, with gloves on, we dip this into the urine, and any type of strip like this usually has to be read within a certain time frame, whether it be 30 seconds, a minute. So as soon as you dip it, you watch your watch or your clock to make sure that you read the strip as soon as it is time. Now, and these just give us rough estimates of glucose or ketones. And so each reagent strip, you compare it to what it's, what is given, and then the color that it turns, and then you would document that color. Once you've done that, you can take your gloves off, just dispose of this in the regular trash can. I just pull my gloves down over the strip, and you're done. Excuse me. And the strip sometimes can test for other things other than glucose or ketones. So they may also check for protein and that kind of thing, and they're read similarly. You just need to read the bottle and know how to properly do that. Again, you need to keep the lids on these containers when they're not in use to keep the strips at their optimum level. Now, the last thing I'd like to talk about, one thing I forgot to tell you, when you are getting, I'm a good bleeder, so I had no trouble getting this blood. You have to really be careful of not being really vigorous with milking, because it can actually alter the blood glucose values if you're too aggressive. Now, again, you want to lower the hand. You can press gently to get, you can see the end of my finger is getting much more red. And I can press and kind of milk it gently. You don't want to do this kind of thing, okay, vigorously. But a gentle milking, again, you know, encouraging blood flow to the end of the finger, like so, is appropriate. But no vigorous milking, because it can actually alter the blood levels. Okay. Then the last thing I want to talk about is the flex pens that are used now, so that it makes it really handy for patients to administer insulin and diabetes medications. This is a Victosa pen. As you can see, they have kind of the end of a syringe type device, and then the rest is a pen. These can be changed out by patients whenever they get empty. Typically they come with a needle, a special needle that actually fits into the end of this little vial. And what you want to do is you always want to clean off, and teach your patients to clean off the end of this vial. You get one of these new needle tips, and as you can see right in here, there's a really tiny needle, and it's actually going to puncture. Hope you can see that. And then so you tear this cover off. Once this is dry, then you just, you know, attach it nicely, take your cap off, and then there's another cap that exposes a very, very tiny needle, and I'm not sure you can even see this needle. And this is the part that then you will prep the skin, let it dry, and then inject. Now, I don't believe this Victosa, I'm not sure, I've never actually given it, but some of them you may or may not have to prep the little hub of this needle. Many of the flex pens and the Novolog pens that we're using, once you get your little needle on it, then sometimes you have to dial in what would be 2 units. And let me use this, because this is the one that I'm most familiar with. And you would alcohol the end, let it dry. Then you insert your needle. Some of these screw on, some of them just snap on. But with these, the original ones, you had to, let me see if I can hold this so that you can see it. You dial this to 2 units. Like so. You can see it on the thing. And then you would inject to fill the needle, and sometimes you will have a little drop come out. You can actually then recap this, take it to the patient's room, and what you would do then is then once you do this, this should go back to 0, all right? Should click back to 0, and then you would dial the ordered dose of insulin, and it's real easy, and you just go slowly up, and say, for example, this patient needed 6 units of insulin. In the hospital setting, you would double check this and show a second nurse your dose, because most times it needs to be documented by 2 nurses. Then you are ready to, some of them have a little cover that covers this vial up too. Sometimes you don't even see the vial. And then you're ready to give your dose. So you just go up, prepare your site, inject. Now the only thing with these pens that you need to instruct the patients is, even after all the medicine goes in, you hold it for a good 10 seconds before you withdraw the needle from the skin. There is a slight delay in all the medication actually going in. So once then you've held it for 10 seconds, then you withdraw it, you dispose of this end of the device in the sharps container, and you replace the cover, and usually it goes in the patient's drawer or in their medicine box. At home, they can just, just carry it with them all the time with extra needles and that kind of thing. But again, depending on which, here's kind of a Cadillac version. This is a Nova pen that operates the same way. You would put the vial of insulin in and then cover it up and go on. And like I said, they make them in different styles and everything. This is actually a saline pen to teach people. Okay, so that pretty much takes care of most of the things. One other thing about the pens here is that some of the pens you may need to prime and some of them you may not. So that will just depend on the pen itself. That's why you need to read the directions carefully. So don't assume that you always have to prime, or you don't always have to prime. Again, you need to check and make sure that, depending on the pen, which is the appropriate use of the pen. Okay, well, this ends our session on glucometer education, and it is not a checkoff skill either. So basically you'll go with your instructor from here on out and be ready to do this, as well as give insulin injections. Thanks. Bye.